It's good to see you again. I think we've had quite the adventure, haven't we? Yeah. Well, tell me about it a little bit. Okay. Oh, alright. You got hit. Okay. Let me take a look. As always, ooh, don't get so excited. I'm just coming close to you. Hold on, turn your head this way a little bit. Perfect. Okay. So, as always, I am a real physician, but everything that you and I talk about here in this secret place, isn't it a beautiful secret place? Look it. It's so nice to be away from Texas. Yeah, I hate it. Everything that you and I talk about, no offense, yeah. There's some beauty everywhere, right? Everything that, and the sky in Texas is pretty lovely, but everything that you and I talk about is for medical self-care only, right? I can't give you official medical advice to diagnose or treat any disease, since you and I have not met in that place where it is required to meet. Of course, well, people who aren't in the secret agency would call it real life. Yeah, but you and I know better, of course. Alright, let me look at the side of your head. So when were you hit? Okay. Alright. Well, good news is, okay, but we did get you a CT scan. Let me go ahead and look at that for a second. Alright, let me have you real quick. We'll do a quick neuro, okay? Look at my nose for a second. Okay. And then can you follow my fingers? Okay, perfect. Very good. Alright. I'm gonna get out my little light. Do me a favor and put this on your finger while I'm doing that. It's just a pull socks. Gotta make sure we're undisturbed. This is a inhabited area. There you go. Yeah, just put that on your finger. Perfect. No, it won't do that. You're fine. So I'm going to use it just like a pen light first, so look at my nose. Okay, other side. Yeah, I'm just looking to see that your pupils contract like they're supposed to. Okay. You have a little bit of a headache. Okay, now I'm actually going to look in your eye, okay? Okay. Other side. Can you do me a favor? Can you go ahead and smile for me? Perfect. I love to see your lovely smile. And then wrinkle your eyebrows. Okay. Alright. So we've gotten cranial nerves 3, 4, 6. May I touch your face? Okay. Close your eyes for a second. Alright. Go ahead and tell me where I'm touching. Okay. Keep your eyes closed and tell me where I'm touching now. Okay. Eyes closed, tell me where I'm touching now. Okay, and then eyes closed, tell me where I'm touching now. Perfect. Alrighty, that's 5. And then can you hear this? Close your eyes and then tell me when you hear that sound again. this side, close your eyes. Tell me when you hear this sound. Okay. I don't have, just real quick, I'm gonna hold it kind of close. Can you tell me what this letter is? The first one right here? Perfect. Okay. Any other visual changes that you've noticed? Okay, blurred vision, anything like that? Okay. Sometimes when you get hit really hard in the head, you can knock loose a retina. You can get retinal detachment. That can really be unfortunate. So, it sounds like we're not having to worry about that. Okay. Alright. So, you had some bleeding, huh? But you took care of it yourself. I see that. Yep. Alright. 3, 4, 5, 6, 7, and 8. And can you puff out your cheeks? Okay. And then, can you do me a favor? Can you say ah real quick? Okay, perfect. Excellent. Well, that's for cranial nerves 9 and 10. I want to look at that your uvula. I want to see your uvula and your palate move up like they're supposed to. In one direction and not to the side or something silly like that. Well, some people have a kind of long, sticky uvula, and it'll look like it's sticking to one side or the other, but that's not what I mean. You have to look at the palate and make sure that it's going up straight. Really damaged uvula, the palate will be out of balance, just like the uvula as well. And it's not that the uvula or the palate are damaged; that's actually damage to the brain. Yeah. Okay. All right. So, can you shrug your shoulders for me? And then squeeze my fingers. Alright, then push up on my hands. Push out. Push in. Okay. And the same thing with your knee. Push up. Okay. Over here on this side, up. Okay. Push in. Alright, push out. Okay. Excellent. Very well done. Okay. And then can you kick your foot up? Alright. And then I'm gonna feel down here. Can you lift up your toe real quick? Okay, just the big toe, Okay. All right. I'm pretty happy with that. I want to do a cerebellar check. Can you do this? And then this. And then this. All right, and then touch your nose and touch my finger. Okay? Go ahead. And over here. And over here. Feeling weird in your... Okay, let's look in your... Okay. I'm gonna go ahead and look around this side. Just making sure we don't have any erythema, ectoderm, any kind of cerebral spinal fluid leakage, anything like that. Gotta make sure we don't have any kind of bulging of the tympanic membrane, anything else. And I'm also just kind of checking out your pinna, touching here, to kind of see it looks like you have a little bit of redness on the pinna itself, but I'm going to go ahead and look at the other ear. I'm pretty happy with that. Okay, so here, same thing. Making sure there's no erythema, no exudates, no bulging of the tympanic membrane, damage to it, no cerebral spinal fluid leakage, making sure that the canal is intact. Looks good. Alright, let's head back to the agency.
That's right. We did want to talk about that. About the health benefits. I told you I would bring you back here and we would look at health benefits of the teas. Thank you for stopping by my tea shop last time. Did you have fun? Good. Which tea was your favorite? Which one do you think you'll have again? That's fantastic. Well, yeah. So as always, I always show you how to check, check to make sure that the health things are legit, right? And so, as always, I always showed you how to use PubMed.gov, right? Because then you can look up the latest studies. And there are other databases, but most of them are closed to the public. Most of them are like Atlas and Up to Date and all these other things are databases that are Dynamid, databases that are synced for doctors, kind of like WebMD, but for doctors and with more accurate, up-to-date information. Yeah. So PubMed is where you can go to actually see the studies. Yeah. Well, we all know you love studies. Of course. Alright. So, let us go onto the computer here. And let's look for the first T. How about this one? Health benefits to be organic. Lavender white. Yeah. I know I look rather young to be a real physician, but I am. And as always, my license number is in the description and so forth. But let's figure out. Let's look at. I want you to not just trust that I've hand selected these because I think that they have good health benefits, but I've hand selected them because they have good health benefits that you can check. I like fact checking. So let's go into PubMed right here. Okay. So PubMed.gov. I know I always worry about my chin. I've gained a little weight. Need to get back out there. Alright, so lavender. So there's a couple of studies that I've actually linked in the description of the tea itself, but basically so there's a couple different studies here that we can look at. So these are 3 different studies. You can look at what lavender does and doesn't work for. So I searched into PubMed. There was effects of lavender on anxiety, a systematic review, and meta-analysis. A meta-analysis is when they take a bunch of different studies and run it through a different set of statistics so that they can see how legit the total sum of the data comes to. It's pretty much the best level of research you can get. So, what they did is they followed what these researchers did, and you can find them. The researchers here were David Donnelly, Michelle Antonelli, and a bunch of other people. This was published in Phytomedicine 2019, December. And so that's how you can find it. And the title of the study is Effects of Lavender on Anxiety, a Systematic Review and Meta-Analysis. And obviously you would like to read the whole paper if possible. But they looked into 65 randomized controlled trials, 7,993 participants, and they found that the big limitation of this review was the low average quality of available studies on the topic. The majority of included RCTs were characterized by a high overall risk of bias. Another limitation regards the heterogeneity of study designs, blah blah blah. So basically, their final results were a little bit, it was a little bit challenging for them, okay? So, overall, the qualitative synthesis indicated that 54 of the randomized controlled trials and 17 of the other studies reported at least a significant result in favor of lavender use for anxiety. The quantitative synthesis showed that lavender inhalation can significantly reduce anxiety levels measured with any validated scale. So they had a 95% confidence interval. And their P was less than 0.00001, so that's pretty good. Any of these studies by themselves wouldn't have been able to show that, but having a really, really, really large pool basically improves your confidence interval and your P. I don't know if you're interested in statistics at all, but it makes a large difference. However, lavender inhalation did not show a significant effect in reducing systolic blood pressure as a physiological parameter of anxiety. A significant effect in diminishing anxiety levels was also found in favor of the use of oral Selexin for at least 6 weeks, or this administration of massage with lavender oil. So it could be taken orally as a tea, or you could take it as a tea if you can't take. They didn't test a tea, but they tested taking it orally in this preparation, and so you could try that, or as oil on massage. So important to note that there are some benefits. It showed that it didn't reduce blood pressure, but it did help with how people reported their anxiety. So that's kind of cool, huh? Another little study, aromatherapy, the effect of lavender on anxiety and sleep quality in patients treated with chemotherapy. Now, we tend to not favor aromatherapy in conventional medicine today, right? We tend to, it's just very difficult to measure and study actual doses that somebody would be getting in, right? And we tend to not like to dose things through the people's lungs anyway, right? So, you won't really find a lot of us conventional physicians who are kind of cool with aromatherapy as a mainstay. However, it can't hurt. And so this was a study that was done, Clinical Journal of Oncological Nursing in 2018, April. So their result was that anxiety before and after chemotherapy did not vary among groups. The authors compared trait anxiety values before and after chemotherapy and found a significant difference in the lavender group. In addition, a significant change in PSQI measurements before and after chemotherapy was observed. However, the limitations of this study was that it was 70 of them, which is a very, very small number of people. You really want to have several hundred, ideally several thousand. But it may reduce anxiety there. So the big study is better. This one is by A.C. Oskaraman et al. And then one more study. This has been my favorite one to cite lately. Again, another very, very small study. Not a lot of great, proven evidence with it, but good still. The effect of inhaled lavender and sleep hygiene on self-reported sleep issues, a randomized controlled trial. What's important about this study is they went ahead and made sure to separate out the different, the people who just got sleep hygiene training and the people who got sleep hygiene and lavender. These were college students. It was, I think, 20-something college students. How many college students was it? I don't see the number here. It was not many. I know it wasn't many. Oh, 79. That's actually good. That's pretty good. Yeah, again, it's not good, but it's something. So, and the lavender and sleep hygiene group did better than just the sleep hygiene group. So that's pretty cool. Exactly. So you can use this to make a difference for sleep. So, I like to look at the evidence for things. I think that that's important and valuable. And obviously the tea plant itself, everyone knows it's got tons of antioxidants. You almost don't even have to look that up on PubMed. You're welcome to do so. But so you're getting the combined relaxation effects together. And obviously, white is going to have the least amount of caffeine of any kind of tea. Any kind of tea around the tea plant, right? So you're going to have your lovely white and your lavender, and maybe have this a couple hours before bed. Not right before bed, because any caffeine can keep you awake, but a couple hours before bed, just kind of to get you in that mood to kind of start relaxing. Yeah. So that's our first tea. Let's look up evidence for. So obviously, green tea. Everyone knows there's just so many fantastic benefits and uses for green tea. But we'll put it into PubMed anyway. Let's look at 3 studies. Let's look at studies on cognition, anti-inflammatory action, and infectious disease. The first three that come up when you look into PubMed. So, this study was published in Biomed Res International 2018 in July about green tea catechins, their use in treating and preventing infectious disease. That's interesting, isn't it? Let's take a look. My computer here, my little laptop. Yeah, I agree with you. So, what they did is they actually, this is a review article, not a study. So what they did is they looked at a bunch of different studies. So this would be interesting for you to go ahead and read, just to get a kind of general idea of it's basically someone who's read the studies for you and is ready to tell you about them. So they're going to go ahead and tell us about the most important components in green tea that show antimicrobial properties are the catechins, and there's 4 different groups of catechins. So we've got epicatechin, epicatechin 3 gallate, epigallocatechin, and epigallocalatin 3 gallate. Of these, 2 of them are found in the highest amounts in green tea and have been the subject of most of the studies. They have been shown to demonstrate a variety of antimicrobial properties built to organisms affected and in mechanisms used. Consumption of green tea has been shown to distribute these compounds and or their metabolites through the body, which allows not only for the possibility of treatment of infections, but also the prevention of infections. Obviously, I will recommend that you go to your doctor if you think you have an infection so you can get antibiotics, because no matter how strong a green tea is, it's not likely to be stronger than, good old doxycycline. Those who know me know that's my favorite antibiotic. However, this is cool, and this is why, I'm excited to recommend and even sell green teas. Really cool stuff. But again, unlike some of these, I think that there are some really sleazy physicians out there, and unlike them, I want you to be able to fact check me. It's incredibly important to me. So, let's look into green tea effects on cognition, mood, and human brain function, shall we? Of course. So, this is another review. Again, these reviews are really good for you to look at because you can just look at all the different studies that have been done. Okay, so this is a review that's in the Journal of Phytomedicine, 2017 October, and it's by Adele Mancini and their group. So, they went ahead and systematically reviewed the PubMed database just like you can. They searched studies by predefined eligibility criteria according to the PRISMA standards, so that's good. They looked at 21 different studies, 4 of which were randomized controlled trials, 12 crossover studies, 4 were cross-sectional studies, and 1 was a cohort study. The average study quality was appraised by means of the LOFI list was good. And the studies evaluated with the Newcastle Ottawa scale were also good, so they did a lot of work to make sure that their studies followed, particular rules. The reviewed studies presented evidence that green tea influences psychopathological symptoms, cognition, and brain function. The effects of green tea cannot be attributed to a single constituent of the beverage. This is exemplified in the finding that beneficial green tea effects on cognition are observed under the combined influence of both caffeine and L-theanine, whereas separate administration of either substance was found to have a lesser impact. That's neat. So theanine is the special compound in tea that makes you feel a little more relaxed. Unlike, caffeine makes you feel alert. I know you like hair scratching too, don't you? Here, let me scratch your hair. Give me just a second here. Scratch your hair on this side. And scratch your hair on this side. And then what we can do is, I can scratch your head on both sides. it's neat to look up studies together. So yeah, beneficial green tea effects on cognition work with the combined, the L-theanine that kind of calms you, and that caffeine that gets you all jazzed up. And obviously, those are different compounds than the ones that we just talked about. Again, this is a review, not a specific study, so they did the work for you. I'm looking up all the studies. Oh, you have something on your ear over here. Something. Okay. You're good to go. Alright, so let's look at the next thing that came up. The next thing was the anti-inflammatory action of green tea. Again, this review article. This was published in Anti-Inflammatory Anti-Allergy Agents MedChem Journal in 2016. So, green tea has been shown to have beneficial effects against a variety of diseases such as cancer, obesity, diabetes, cardiovascular disease, and neurodegenerative disease. I mean, it's been very heavily studied. There's still something on your ear, I think. I see something over here. You have like some little goo or something on your ear. There, that's better. I think that's good. So, most of the results of the human studies indicate the beneficial effects of green tea and catechins for prevention and treatment of inflammatory diseases, right? The cellular and animal studies also provide evidence for the favorable effects. Now, so by levels of evidence, right? A case control study, so a case study is like the lowest level of evidence, where you look at a case and you see how something happened to this particular patient. You know, your N is 1. In the case control, you have multiple studies and you look at them and you compare how things happen. You can do retrospective studies where you look at people's hospital data and then from that try to make conclusions. The best kind of, just individual studies can be a randomized controlled trial, and that's where you have two different groups that you've separated. And I have a bunch of other videos on how to assess evidence, but you have two different groups, and one group had the intervention, one group did not. So you have a good control group, and you can check for the placebo effect, right? That's, superior. After that, you also want to make sure that the researchers and the people in the groups don't know which group they're in. That's called a double-blind randomized controlled trial. And it's randomized. People are assigned to their particular groups randomly. They don't know what group they're going to be assigned to. Yeah, exactly. So that's the best. And then, of course, a meta-analysis is great, and technically even above that, because a meta-analysis can take all of the different data from multiple studies, put them together, and try to draw conclusions. It's just difficult to do correctly. You have to have a really good statistician on board. And then, you're right. Well, where do review articles fall? Well, review articles, if they're done with a meta-analysis, then of course they're way up there. But most review articles are just kind of taking and giving information and guidelines from multiple studies. So they're not really a level of evidence. They're really something you read before you start looking into the actual studies, basically. So these are all review articles, but they've got a lot of different studies in them that you could look at. And so because green tea covers so many fields, I think that that's a good place for you to start if you're looking for evidence for green tea, is to start with the review articles and then look at the studies that they cite. So, since green tea and EGCG have multiple targets and act in a pleiotropic manner, we may consider their usage to improve the quality of life in patients with inflammatory diseases. They have beneficial health effects and no severe adverse effects. Care should be taken to avoid overdosage, which may include deleterious effects, including hepatic injury. It would be very difficult. You would have to drink a lot of tea. I think it would also hurt your kidneys to be peeing all the time. So, that's the benefits with green tea. Alright, let's keep exploring the health world of tea. How about bergamot? Bergamot in Earl Grey. So, black tea, which is one of the components in here, has the same kind of benefits as green tea does. You can look back through the green tea information doesn't have the same level of antioxidants because it's been oxidized. It's been, that's like rusted. So it doesn't have the same benefits that a green tea does. So you can look into how that process changes it, but essentially I'm going to tell you, green tea is where you get your antioxidants, your huge anti-inflammatory boost, and everything else. You don't get that anymore, and all the anti-inflammatory, anti-infectious disease. That's not what you get with a black tea. With a black tea, you still get those beautiful theanines and those beautiful caffeines that help you stay lifted and help your cognition, right? But bergamot, let's look into bergamot, the addition of bergamot into your tea. Okay. Alright. So we're just going to pull it up, same thing, PubMed.gov. That's, where you check to see if, especially if a doctor is lying to you and so forth. That's what you go to check. So bergamot. Let's see what we have on bergamot. So I found one study that was done in rats and one study on people. This is an overview. Efficacy of bergamot. Okay, let's start with these two. So this one was published this is a review article published in Phytomedicine 2016 October. They talk about dyslipidemia being when you have too much fat in your blood. That's when your cholesterol is up, and they're looking to see do the studies indicate that bergamot has any effect. So they summarize the current evidence. The problem is that we don't have any, the studies are not very clear. So the natural supplement may lead to effective lipid-lowering treatment, as lipid-lowering activity is attributed to different flavonoids, but its exact mechanisms remain unclear. It is expected that ongoing and future studies will confirm the benefit of bergamot in dyslipidemia and other cardiometabolic disorders, potentially leading to reduced overall cardiovascular risk. So potentially. Unfortunately, this is a review article that doesn't have like a meta-analysis or anything with it. So you really have to read the full article yourself and kind of draw your own conclusions based on the studies that they cite. It's not in itself a study or an authoritative source of evidence, but we have found something that indicates bergamot may be helpful in lowering cholesterol. I'm not going to make any wild claims, and I'm not going to give you bergamot instead of a statin, which is, obviously the official medical treatment that we would use, but it's something to think about, something to look into. So there's this other study that was done in rats. This is in the Journal of Molecules 2017, April 11th, by Laura Rambola and another large group of scientists. Preclinical studies have recently highlighted that bergamot essential oils is endowed with remarkable neurobiological effects. It can affect synaptic transmission, modulate EEG activity, and it shows neuroprotective and analgesic properties. What does that mean? That means protection from, and again, we're not going to make really out there claims, but it did seem to protect your brain cells, right? Which is helpful if you have like a family history of dementia or things like that. And so analgesic properties means it's helping with pain. So that's interesting. It's widely used as aromatherapy, but aromatherapy is incredibly difficult to study because you can't make a good randomized clinical trial. You can't really have a control group that's smelling a fake bergamot. It's going to still smell like bergamot. You can't, people know what is and isn't Earl Grey, or what is and isn't a citrus when they smell it. So they'll know what group they're in, and that's going to mess up. You're going to have your placebo effect completely messed up. So, in this study, they examined the anxiolytic sedative-like effects of bergamot essential oil on an open field task, an elevated plus maze task, and a forced swimming task in rats. I hate when they do that to rats. It's almost kind of abusive. Like, I get further compared behavioral effects to those of the benzodiazepine diazepam. Looks like you have something on your ear here. Hold on. I think I almost got it. I'm not quite sure what it is. Do you know? Oh. Do you have birds? It looks like you've got like feathers in your ear. That's funny. Nothing on this other ear though. I think this other ear is fine. Alright, so this study did that, right? It made rats do all that stuff, and then it compared the behavioral effects of giving them bergamot compared to giving them a drug called benzodiazepine. Analysis of the data indicated that it induced anxiolytic or relaxant effects in their tasks, not superimposable to those of the diazepam, the benzodiazepine. The present observations further insight into the pharmacological profile of BEA and support its rational use in aromatherapy. So they did aromatherapy on the rats, and the rats got chilled out. That's cool. Again, this is going to be really difficult to replicate in humans, and to really have a good control group. And that's the problem with a lot of these essential oils type treatments. I am going to usually push for something that's taken into your body over something that's nailed or anything else like that. So, the evidence with bergamot is a little bit funny that we've found so far. But obviously this is only a quick search of PubMed. You can search much more. So this is interesting. The neuropharmacology of the neuropsychiatric symptoms of dementia and role of pain, essential oil of bergamot as a novel therapeutic approach. This is a review in the International Journal of Molecular Science, 2019, by Damiana Scuteri et al. So, what is this? This is a review, right? So they're trying to see basically if bergamot essential oil is helpful and neuroprotective in people with Alzheimer's or people with pain, right? It has extensive preclinical evidence of analgesic properties. Incidentally, the essential oil of bergamot induces anxiolytic-like effects devoid of sedation, typical of benzodiazepines, with a noteworthy advantage for demented patients. So it's a problem to give demented patients benzodiazepines, and they're recommending that maybe we can try to calm them down with things like bergamot instead. It's something to think about. These data, together with the reported safety profile, form the rational basis for bergamot as neurotherapeutic to be trialed for the control of behavioral and psychological symptoms of dementia. Again, it's going to be incredibly difficult to do a full, real randomized clinical trial on something like that. They would be much better off. It'd be much easier for them if they put the bergamot in a pill or put it even just in a drinkable solution. It's going to be a lot easier to study. But the initial opinions and evidence and things from the community, there's some positives. So it might be. We'll go with maybe for the bergamot. Alright, next. We've done 3, right? Organic jasmine green. obviously any of these things are going to be dangerous to you if you are allergic to them. Should be something that should be mentioned. This is an excerpt from the Drugs and Lactation Database, Lavender. This is interesting. Jasmine flowers contain a variety of chemicals, although none have been identified with specific pharmacological activity. In India, Ayurvedic medicine, jasmine has been used to suppress lactation, and in one published study found that jasmine leaves applied to the breast suppress postpartum lactation as effectively as oral bromocriptine. However, this study was not of high quality. No data exist on the excretion of any components of jasmine into breast milk or on the safety and efficacy of jasmine in nursing mothers or infants. But if it might stop breastfeeding, probably that's not something you want to do, right? So probably maybe don't, even if the study was poor quality, maybe you don't want to take jasmine while you're breastfeeding. So something to think about. However, it is unlikely typical jasmine intake, such as drinking small amounts of jasmine tea, would be harmful during nursing, is what Lavender has decided. And they talk about supplements. Needs a lot more study. So we don't know the safety or effectiveness of this product. That's interesting. I know there's also word on the street about jasmine for people with breast cancer, but again, I'm not going to recommend something like that I don't feel very, very safe with. You would need a lot of evidence to convince me, and it doesn't even come up here on PubMed. I'm not seeing that evidence, right? Yeah, exactly. So you would want to be very careful. However, we like the smell. Jasmine is relaxing. Maybe might have an effect on female hormones, maybe not. Let's keep looking. Let's see if we can find. No. I can imagine that because it's kind of calming, it could be used in palliative medicine for helping people calm down. But it seems to be pretty. This is interesting. Alright, I might have found some. Oh wow, that's an interesting study, totally irrelevant to what we're doing. So there is a randomized control trial in Doct 2015, April, by Philip Finney et al. It says jasmine flower extract lowers prolactin. Antipsychotic drugs frequently cause amenorrhea and galactorrhea. Jasmine flowers used topically were as effective as oral bromocriptine in suppressing puerperal lactation. So they're wanting to use jasmine flowers, like we talked about in the Lavender database, to stop people from lactating or are lactating by accident as a side effect of their antipsychotic drugs. This study aims to evaluate the efficacy and safety of intranasal jasmine flower extract to reduce prolactin levels on stable doses of psychotic drugs. So they want to try it differently instead of on the breasts. They had 35 women, and 10 out of the 35 had a significant drop in the serum prolactin while on the jasmine flower extract. So that's neat. So it is possible, right? Again, these are tiny studies. These are not good quality studies. You really can't say for sure. It's not like with green tea where there's many, many, many studies about its efficacy, or even lavender and jasmine. It could beneficially protect and alter the female hormones, which means you could consider it as a preventative for things like that. That's why there's word on the street about using it preventative for breast cancer. I don't have enough evidence to make that claim, but if that's something that you're worried about, maybe drink a lot of jasmine and see if it helps you. That's a possibility. Maybe don't drink it a lot when you're trying to breastfeed. But again, the evidence is really slight. It could be that maybe it's just very, very weak in whatever it does. Okay? So it's something that could add. Now this is interesting. This is in the Frontier of Aging Neuroscience. This is a review article in that journal in 2017. against neurological disorders, Jasmine being one of them. They tried to summarize the current findings tested against neurodegenerative disorders like Alzheimer's disease and dementia, and trying to prevent amyloid deposition, neurofibrillary tangles, cholinergic hypofunction, oxidative stress, and glutaminergic abnormalities. So this might be a good study to look up and read. It's not really a study, it's a review article. You could look at and see if the study is cited or what you're looking for. Exactly. Let's get to the next one. So, masala chai. This is going to be hard to find data on, but it's delicious, so it almost doesn't matter. As you know, of course, the black tea in it, everyone knows already, it's got L-theanine and caffeine, which, is good for your brain. But let's look up and see. Cinnamon. Cinnamon is widely studied in diabetes. I actually have a really good little series of different studies linked here. So first, both cinnamon and cardamom have been found to lower cholesterol. That's from the study in the fall-winter of Rev Diabetic Studies. It's a review of diabetes studies. 2014 by Peria Azimi, and I link to it in the product description when you get the tea. Effects of cinnamon, cardamom, saffron, and ginger consumption on markers of glycemic control, lipid profile, oxidative stress, and inflammation, type 2 diabetes. And there were positive changes in all of that. So that's a great study to look at if you are interested. There's also ginger in this lovely thing. Ginger, which, we've used that to reduce vomiting in pregnant women, because it helps with nausea. We've used it for people on seasickness, like that's just commonly known. And again, that's, there's a study in the Canadian Family Physician 2016 that you can look at. Isn't this lovely? So, possibly lots of good health benefits. Obviously, chai has been used in Ayurvedic medicine for centuries. So, neat stuff. Alright, next. This is the peppermint ginger green. We're going to go on PubMed.gov and look up our studies. So, green tea, we've already talked about in the section just on green tea. And obviously, that's going to be, this is well proven, lots and lots of data on green tea. We're going to talk about ginger and peppermint real quick. So let us go to PubMed.gov. So ginger and peppermint. And obviously these are going to be like literally tingly because they're compounds that kind of, they've got that sharpness in your face. Peppermint has been used from everything to nausea, to pain relief, to even like soothing nipple sensitivity during breastfeeding. It's in like diaper balm and things like that that are regularly prescribed for pain. The peppermint oil, it's actually even been used. There's a new study in the Clinical Journal of Oncological Nursing on using it in the ambulatory setting for people who are having nausea from chemotherapy, using peppermint for that, right? So that's a study that you can read that was published in 2020 by Carlissa, PUMAP, and their big team. And then it has been, if you go to the Lactamed database, Lactamed, not Lactamed, you can look at too. It's got menthol, menthol acetate. Some people have allergic reactions like headache. Okay. If you do use it on the nipples, it should be used after nursing and wiped off before the next nursing. Okay. So there's a lot of safety, but it was shown to be helpful for like cracked nipples and things like that. I swear there's still something on your ear over here. I really think so. I'm not sure what it is here. Oh, it's just a lot of money. Why do you keep money behind your ear? That's pretty cute. impressive setup you have back here. How did you do it? How strange. Alright. So, topical peppermint gel and solutions of a safe for the prevention of pain and cracked nipples, areolas, in nursing women, as we have already established. So, let us continue. I think I just wiped some of my makeup off while I was investigating your ear. I mean, it's been used for a lot of different things. It's also the same thing that you get in like Vicks Vapor Rubs. I mean, everyone knows peppermint oil. There's a lot of good stuff for you. Ginger is consistently used to reduce nausea and vomiting in pregnancy. There was a good study for that, as we mentioned in a different section, in the Canadian Family Physician Journal in 2016. There was a good review article by Adrian J. Lindblad about it. So it's been used for good stuff, and I've prescribed it before. It's actually sold over the counter for seasickness. Yeah, and it helps. Dramamine it actually has a version of itself that is ginger instead of the official Dramamine compound. So yeah, good stuff up in here. Finally, the Lapsang Sucha. So, when we're evaluating the clinical benefits of this, let's just talk about the clinical benefits of black tea. So, black tea doesn't have the same antioxidants as green tea does because exactly it's been oxidized to get there. However, one of the amazing, properties of tea that you still have is the theanine, which is calming and good for your brain. And there are so many. I mean, look up theanine. Here, just go to PubMed and just put in theanine. You're going to see, tons and tons. You're going to see, GABA, change in sleep latency, improvement of REM sleep from the Journal of Pharmacological Biology in 2019. You're going to see psychotropic effects from management of anxiety and stress to potential use in schizophrenia, and the pharmacological, PharmacoRes 2019, right? You're going to see in the nutrition neuroscience acute effects of theanine, caffeine, and theanine caffeine combination on attention. There's so many studies. Just go to PubMed, type in theanine. It's awesome. And it has been found that the theanine, and that's why that last study looked at the combination, theanine plus caffeine have better effects on improving mental focus than just caffeine itself. This is why the ancient sages were all about this stuff, right? Because it helped them meditate, it helped them focus, right? So better than just caffeine on its own. So yeah, and Lapsang Soup-Chang obviously has that kind of special smoky flavor. So yeah, so I feel comfortable recommending teas, and I think that I feel safe recommending and even selling these things because I think that we can fact check it, we can figure it out. Yeah. So please fact check me, look into stuff, and have fun with it. Yeah. Yeah. Always, when you get information, you always, no matter who it's from, even if it's someone with a degree, you always trust but verify. Yeah. Absolutely. Alright, well that sounds good.